Welcome to this public service announcement. I'm just going to be talking about YouTube and their COVID-19 medical misinformation policy that was published on May 20th, 2020 and has not been updated since. And they are still sticking to these guidelines. And I also want to point out that this channel was studying religious information in the past years. And even though I'm not doing that presently, I still believe in questioning my beliefs because I don't want to be in a cult. If you cannot question your beliefs to see if they make sense, if they're logical, if something is actually scientifically true, or if somebody's just been telling you a lie over time and you believed it through brainwashing, that's a sign of a cult. If you just have to take it on faith and you cannot question it, you should be able to question your faith. What do you have faith in? Are you questioning things? I don't like it when somebody says, "Don't question us," because that says cult to me. That says idolatry to me. And it just screams religion. And that's partly why I'm bringing this up. But I'll just let you think for yourselves, because you are a person who is very logical and you can think for yourself. And I don't think of you as a victim who needs to be saved. However, this whole thing is a company that is acting like you are a victim who needs to be saved, and it is Drama Triangle Dynamics. You can check out my videos for more information on the Drama Triangle if you haven't. So I'm just going to read this. You can make up your own mind about things. COVID-19 medical misinformation policy. The safety of our creators, viewers, and partners is our highest priority. We look to each of you to help us protect this unique and vibrant community. It is important you understand our community guidelines and the role they play in our shared responsibility to keep YouTube safe. Take the time to carefully read the policy below. You can also check out this page for a full list of our guidelines. This link will be below, then you can check out the hyperlink if you want. YouTube doesn't allow content about COVID-19 that poses a serious risk of egregious harm. YouTube doesn't allow content that spreads medical misinformation, that contradicts local health authorities or the World Health Organization's medical information about COVID-19. This is limited to content that contradicts WHO or local health authorities' guidance on treatment, prevention, diagnosis, transmission, social distancing, and self-isolation guidelines, or the existence of COVID-19. Note, YouTube's policies on COVID-19 are subject to change in response to changes in global or local health authorities' guidance on the virus. This policy was published on May 20th, 2020. What this policy means for you. If you're posting content, don't post content on YouTube if it includes any of the following. Treatment misinformation. Content that encourages the use of home remedies, prayer, or rituals in place of medical treatment such as consulting a doctor or going to the hospital. Content that claims that there's a guaranteed cure for COVID-19. Content that recommends use of ivermectin or hydroxychloroquine for the treatment of COVID-19. Claims that ivermectin or hydroxychloroquine are effective treatments for COVID-19. Other content that discourages people from consulting a medical professional or seeking medical advice. Prevention misinformation. Content that promotes prevention methods that contradict local health authorities or WHO. Claims that there is a guaranteed prevention method for COVID-19. Claims that any medication or vaccination is a guaranteed prevention method for COVID-19. Content that recommends use of ivermectin or hydroxychloroquine for the prevention of COVID-19. Claims that wearing a mask is dangerous or causes negative physical health effects. Claims that masks do not play a role in preventing the contraction or transmission of COVID-19. Claims about COVID-19 vaccinations that contradict expert consensus from local health authorities or WHO. Claims that an approved COVID-19 vaccine will cause death, infertility, miscarriage, autism, or contraction of other infectious diseases. Claims that an approved COVID-19 vaccine will contain substances that are not on the vaccine ingredient list, such as biological matter from fetuses, e.g. fetal tissue, fetal cell lines, or animal products. Claims that an approved COVID-19 vaccine will contain substances or devices meant to track or identify those who've received it. Claims that an approved COVID-19 vaccine will alter a person's genetic makeup. Claims that COVID-19 vaccines do not reduce risk of contracting COVID-19. Claims that any vaccine causes contraction of COVID-19. Claims that a specific population will be required by any entity except for a government to take part in vaccine trials or receive the vaccine first. Content that promotes the use of unapproved or homemade COVID-19 vaccines. Instructions to counterfeit vaccine certificates or offers of sale for such documents. Diagnostic misinformation. Content that promotes diagnostic methods that contradict local health authorities or WHO. Transmission misinformation. Content that promotes transmission information that contradicts local health authorities or WHO. Content that claims that COVID-19 is not caused by a viral infection. Content that claims COVID-19 is not contagious. Content that claims that COVID-19 cannot spread in certain climates or geographies. Content that claims that any group or individual has immunity to the virus or cannot transmit the virus. Social distancing and self-isolation misinformation. Content that disputes the efficacy of local health authorities or WHO's guidance on physical distancing or self-isolation measures to reduce transmission of COVID-19. Content that denies the existence of COVID-19. Denial that COVID-19 exists. Claims that people have not died or gotten sick from COVID-19. Claims that the virus no longer exists or that the pandemic is over. Claims that the symptoms, death rates, or contagiousness of COVID-19 are less severe or equally as severe as the common cold or seasonal flu. Claims that the symptoms of COVID-19 are never severe. And then there's a bunch of examples, such as denial that COVID-19 exists. Claims that people have not died from COVID-19. Claims that any vaccine is a guaranteed prevention method for COVID-19. Claims that a specific treatment or medicine is a guaranteed cure for COVID-19. Claims that hydroxychloroquine saves people from COVID-19. Promotion of MMS, the miracle mineral solution for the treatment of COVID-19. Claims that certain people have immunity to COVID-19 due to their race or nationality. Encouraging taking home remedies instead of getting medical treatment when sick. Discouraging people from consulting a medical professional if they are sick. Content that claims that holding your breath can be used as a diagnostic test for COVID-19. Videos alleging that if you avoid Asian food, you won't get the coronavirus. Videos alleging that setting off fireworks can clean the air of the virus and will prevent the spread of the virus. Claims that COVID-19 is caused by radiation from 5G networks. Videos alleging that the COVID-19 test is the cause of the virus. Claims that countries with hot climates will not experience the spread of the virus. Videos alleging that social distancing and self-isolation are not effective in reducing the spread of the virus. Claims that wearing a mask causes oxygen levels to drop to dangerous levels. Claims that masks cause lung cancer or brain damage. Claims that wearing a mask gives you COVID-19. Claims that the COVID-19 vaccine will kill people who receive it. Claims that the COVID-19 vaccine will be used as a means of population reduction. Videos claiming that the COVID-19 vaccine will contain fetal tissue. Claims that the flu vaccine causes contraction of COVID-19. Claims that COVID-19 vaccines are not effective in preventing the spread of COVID-19. Claims that the COVID-19 vaccine causes contraction of other infectious diseases or makes people more vulnerable to contraction of other infectious diseases. Claims that the COVID-19 vaccines contain a microchip or tracking device. Claims that achieving herd immunity through natural infection is safer than vaccinating the population. Claims that COVID-19 never causes serious symptoms or hospitalization. Claims that the death rate from the seasonal flu is higher than the death rate of COVID-19. Claims that people are immune to the virus based on their race. Claims that children cannot or do not contract COVID-19. Claims that there have not been cases or deaths in countries where cases or deaths have been confirmed by local health authorities or the WHO. Educational, documentary, scientific, or artistic content. We may allow content that violates the misinformation policies noted on this page if that content includes context that gives equal or greater weight to countervailing views from local health authorities or to medical or scientific consensus We may also make exceptions if the purpose of the content is to condemn or dispute misinformation that violates our policies. This content must appear in the images or audio of the video itself, providing it in the title or description is insufficient. I suppose this is why some things are allowed in satirical, artistic content in some ways. Would you have believed any of these things? Do you believe that you are smart enough to figure things out, or do you feel like you're kind of being condescended down to from YouTube? Well, these are their rules, and we'll stick with them. These things are misinformation, according to YouTube, and I guess the global authorities. I think that's where they got their information from, because I've seen local authorities disregard these and being taken off of YouTube. In other news from Brett Weinstein, vaccine EUAs require there not to be a safe, effective treatment. EUAs are the emergency use authorizations. So the COVID vaccines are under EUA and they are not FDA approved as of this time. So they're under emergency use authorization, and if there were a safe, effective treatment, then the COVID vaccines could not be used. If there were a safe, effective treatment of COVID-19, the vaccines could not be used. Quote, "When you tear out a man's tongue, you are not proving him a liar. You're only telling the world that you fear what he might say." As I mentioned with the drama triangle, people who are trying to force other people to do things, to not say things, etc., these people have a feeling of powerlessness because they feel like they need to control through their actions what other people are doing or not doing. There are certain people out there, big groups, who are totally afraid right now, which proves that they are feeling powerlessness, which is why they are trying to take their power back through actions such as telling people what they can and cannot say, can and cannot do. You don't have to play in the drama triangle with them. You don't have to see them as the persecutor. You can just take personal responsibility for your life. Go to your local doctor if you want information on what your doctor would say. You don't want to take medical advice from people off the internet. You have to take personal responsibility for your health. No matter what anybody says on the internet, myself included, you should not take what other people say for why you get a treatment or don't get a treatment. It's time to take personal responsibility for your health and stop scapegoating. Stop saying we have to stop those people talking on the internet and what they're saying, because all that does is make echo chambers, because people who believe the things on that list are going to go to where they can listen to people who believe the things on that list. And if you do that, you end up in listening to lots of really crazy conspiracy theories. And the same goes for YouTube. I mean, YouTube becomes an echo chamber also. So all this is doing is creating two different echo chambers. You're creating the conspiracy ones, although I'd have to say people there actually do listen to both sides more often. But on YouTube, you got this huge echo chamber where people are only talking about these things. Ask yourself, if somebody posts any of this on YouTube, it's automatically deleted. I mean, it's just going to be taken down. And if that's the case, you're never going to see these things. So all you're going to see is the echo chamber of whatever is the opposite of what this says, which you can figure out because you are smart. So it becomes an echo chamber of only what this is saying, which again seems cultish because you're not allowing questioning, you're not having discourse, I would suggest checking out Brett Weinstein on Odyssey, which is library which I talked about in the past. I've lost my keys to my library account, so I'm not actually making any money off my YouTube channel. I mean, my YouTube channel automatically uploads things to library, and I'm not making any money on library off that stuff. But anyway, library is a good place because it's decentralized and it is a good backup for videos. But check out that. I'll put some links below if you want to check that out. But I'm not saying that you should take his advice or anything. Obviously, your own. You have to do your own. People should be responsible for their health, and nobody else should be responsible for your health. It's time that people realize this. And I think this is a good wake-up call for many. Have a great day.